That morning was a fairly, typical morning, and I was going down the hall in the operating room, and one of the residents in surgery, Dr. Chuck Crenshaw, came into a conference room where I was. He knocked on the door, and I went out to out of the door of the conference room where I'd been holding a little session with students. And he said, "Dr. Mack, could you step out here for a moment? I need to tell you something." And so I stepped out, and he said, "They've just called the emergency room and said that President Kennedy in his motorcade downtown had been shot. And they want all of the faculty surgeons to come down immediately to the emergency room." And so that's how I first heard about it. We went down the elevator, which was just the second floor was the operating room, and the ground floor was the emergency room just below the operating room. And so we rode down in the elevator, and as we were riding out, I said to them, I said, "Well, we're often hear stories about terrible things that have happened, and it turns out they're not quite as bad as we thought they were when we actually see the case in the emergency room." So with that, the doors of the elevator came open, and I walked out around a little corner room into the big area called the pit in the middle of the emergency room, and I saw this large crowd of men in business suits all wearing hats. Back in those days, everybody wore a hat. And as I stood there, I thought I'd never seen a crowd of people like that in the emergency room the many times I'd been there. And so as I stood there for a moment, the crowd spontaneously parted, so that I could see about probably 40 or 50 feet through the little corridor that was made by that crowd parting to 4 rooms off the back of the emergency room, trauma room 1, 2, 3, and 4. And sitting outside of trauma room 1 in that hallway was Mrs. Kennedy in a folding chair, sitting there quietly holding her bag. And, I thought myself, my goodness, this is just exactly what they said. I had to literally force myself to continue walking back toward her.
Dr. Robert McClelland, would you please tell us what you were doing on the morning of Friday, November 22nd, 1963?
On that morning, I was at Parkland Hospital in the operating room on the second floor. And I was on call that day, as you said, and so that's where I was.
And were you in the classroom teaching some residents?
Yes. And as I was talking to the residents, I heard a little tap on the door, and so I got up, went to the door, and looked out. And standing there was one of our senior surgery residents, Dr. Charles Crenshaw. And he said, "Dr. Mack, would you step outside here for a moment? I need to tell you something." And so I went in and shut off the lantern slide machine that I was using and stepped outside. And he said, "They've just called the emergency room and said the president has been shot downtown in his motorcade, and they're bringing him right now, and he's arriving at Parkland Hospital, and they want all of the surgical faculty to go down to the emergency room immediately."
And then you proceeded to go to the trauma room 1, and who was one of the first people you encountered?
Well, we rode down on the elevator from the operating room, which is only 2 floors below the operating room the emergency room was. And as we were riding down with Dr. Crenshaw, the resident who came to get me, I told him, I said, "Well, Chuck, we often get stories about what's being brought into the emergency room, some terrible thing, and it turns out that it wasn't quite that bad." Well, with that, the door came open to the elevator and into the big area we call the pit on the area where the emergency room was, 2 floors below the hospital. And when we walked out of the elevator into this probably 50-foot wide area, it was jammed with men in business suits, all wearing hats. Everybody wore a hat back in those days. And I looked at that and I thought to myself, I've never seen anything like this down here. And as I stood there with that thought in my mind, that crowd of men parted spontaneously so that I could look down the little corridor that was made back to 4 rooms, trauma room 1, 2, and 3, that were just off of the main emergency room. And there, sitting in her bloody clothing on a folding chair outside of trauma room 1, was Mrs. Kennedy. And so I was aghast at having seen that, and I thought, as I walked on back toward her, this is exactly what they had told me.
Why were you aghast at what she looked like?
She was sitting very calmly in a folding chair, as I said, just outside trauma room 1, and she had on her bloody clothing, that pink suit that she was wearing, but she was very, self-contained. She was not hysterical or crying, but obviously very upset. And so we walked by her directly and pushed the door to trauma room 1 open and walked into trauma room 1. And the first thing that I saw there was the terrible sight of the president lying on his back on a cart in the trauma room 1 with his bloody head looking toward us at the door, or toward me at the door.
Where were some of the senior staffers at the moment?
I'm sorry?
Where were the senior staffers, because this was the lunch hour, where were all the... See, he was only... Tell him how old you were when you...
It was 2 days past my 34th birthday. And my chief of surgery, Dr. Tom Shires, I knew was out of town in Galveston as a visiting professor. And as I walked back toward Mrs. Kennedy in trauma room 1, I thought to myself, my goodness, I may be the only faculty, very junior faculty person here, because I thought he was gone. I mean, I thought, the other members of the faculty were out of sight. And I walked on down toward Mrs. Kennedy and walked by her, pushed the door to trauma room 1 open, and was gratified to see that I was not, horrified to see the president in the condition he was in, but gratified at the same time that I was not alone, that there were other faculty people there before I was.
So in those few moments there, because the other doctors were at the lunch hour, and your chief of staff was it Galveston?
I'm sorry?
Dr. Shires was in Galveston?
He was in Galveston.
There was a time there you thought you were the...
There were a few moments there when I was terrified to think that I possibly, there at the noon hour when my other faculty, associates were very likely out to lunch outside of the hospital, and that I might be the only person there, the only faculty person there.
And then when you walked in, who all was at the table assisting the president?
Well, I was, horrified when I saw the shape the president was in, but I was also, again, grateful that I was not alone, that other faculty members, Dr. Malcolm Perry and others, had walked in just before I got there.
And what was Dr. Perry doing when you walked in?
Well, he was standing by the president who was lying on a cart and getting ready to do a tracheostomy on the president. Even though when the president came in, Dr. Jim Carrico, who was an intern in the emergency room, but was later the head of our surgery department many years later, had the presence of mind and the ability to grab an endotracheal tube the minute the president rolled into the back door and take a laryngoscope and put a endotracheal tube into his windpipe and connect him to a breathing machine and roll him back toward trauma room 1. People sometimes ask, why then did Dr. Perry do the tracheotomy? Well, the tracheotomy gets you right down to where you need to go without all of the complications that can be associated with an endotracheal tube.
What were some of those potential complications?
Well, complications is that, first of all, you just can't get an adequate view of any trauma that's in the neck, and you may also lose, control of that ventilatory tube, And then, of course, there are later complications, but the main concern is losing control at the time of the injury.
Can you explain the reasons, the ABC theory behind why Dr. Perry elected to do the tracheotomy?
Well, again, to gain, more personal, more definite control of the airway, to be able to breathe for the president without taking a chance that the endotracheal tube might be poorly placed or would come undone. You can very securely secure a tracheotomy tube into the airway.
Can you tell the audience a little bit about the ABCs of emergency care?
Well, you look at airway, bleeding, and coagulation. And the first thing, though, is airway. They must be breathing.
See, Dr. Perry had told me that for a few precious seconds, and I'm talking few precious seconds, he thought he could save the life of the president because the first bullet had miraculously avoided the carotid artery and the spinal column. Is that your understanding?
That's true.
And so consequently, he elected to do the tracheotomy. But then, and you tell us how you assisted with the tracheotomy.
Well, as I said, I came into the room, and Dr. Perry was standing opposite to me next to the president, who was lying on the cart. And Dr. Perry handed across to me an endotracheal tube and said he was going to put this in, and would I go and stand at the head of the cart and hold a retractor in the incision that he was about to make in the president's neck to insert the tracheostomy tube.
And then what happened next?
Well, I went in just as he said, and as he made the incision in the neck to expose the windpipe, the trachea, I was in position at the very head of the cart, about 18 inches above the president's head, and holding a retractor in the incision so Dr. Perry and Dr. Baxter, who was helping him, could see to place the tracheotomy and the tube into that passage.
At what point did you recognize that there was another bullet wound?
Well, I knew that he had another shot, and I said he's got a large hole in the back of his head, and I asked Dr. Perry, I said, have you seen this injury? And he said, no, we just got in here right before you did, and we didn't have a chance to examine him. And I said, well, there's a massive hole in the back of his head about where I'm putting my hand that's at least 5 inches in diameter. And at that time, we couldn't really tell whether the shot had been fired from the front or the back, and not until many years later, when I first saw the Zabruder film of the assassination, did I then come to the realization that the bullet had apparently been fired not from the back, but from the front behind the picket fence on the grassy knoll.
This is where Dr. McClelland disagrees with the Warren Commission. The Warren Commission concluded that that second bullet wound, or third perhaps, or even fourth, came from the back. And it is your belief that it probably came from the front.
The bullet that killed him, I'm not certain of anything, but I'm as close to certain as I can be, that as I watched many years later, saw the Zabruder film, I saw the president's limousine coming around off of downtown and going onto Elm Street, and as the limousine slowly proceeded down toward the triple underpass there on Elm Street, the first thing I saw that was out of line was the president all of a sudden, as they made the turn onto Elm Street, that he put his hands up to his neck like that, as though something had happened. And they came slowly on down toward the triple underpass, and Mrs. Kennedy by now realized something had happened, and she was leaning over to him as if to ask, what's wrong, as he had his hands up to his neck. And as he did that, and as she did that, all of a sudden his head literally exploded and fell backwards and to the left, as if he had been hit from the front with the second shot.
Now, In the next few moments there at the trauma room, you realized that, describe how the president's heart was performing.
Well, when I first came into the emergency room and walked into Trauma Room 1, he had been attached by, excuse me, he had been attached to a breathing machine, with an endotracheal tube, and they were breathing for him that way. People sometimes ask, why did you do a tracheotomy then if there was an endotracheal tube in place? Well, an endotracheal tube can get displaced, and a tracheotomy gives you much better view and a secure, passage into the airway. And so that's why Dr. Perry was doing the tracheotomy.
You had indicated that the president's heart was actually performing quite well.
Yes, it was. He had, of course, been as routinely, when they come into the trauma room, placed on a cardiac monitor, and he had good cardiac monitor activity when he first came in, and was even making attempts to breathe. His chest was moving, and then as we just got started on him, and I had moved into place, all of a sudden his heart stopped, and you could see that on the cardiac monitor. And Dr. Perry initially, made some pumps on his chest, and Dr. Clark, our neurosurgeon, had come into the room and was watching the cardiac monitor. And when he saw the cardiac monitor go straight line, he said to Dr. Perry, he said, "Mac, you can stop now because he's gone."
It was at that point that a couple of you attempted to massage his heart?
Yes. We made several with open cardiac massage had not been used open cardiac massage had been used up until that time, and just recently there had been studies showing that closed chest compression in many instances would start the heart, and so that's what we chose to do here. We could do it quicker and better to pump on his chest, but then it became apparent that was ineffective.
Who had the awesome responsibility of telling Jackie that her husband had passed away?
Well, Dr. Clark, the neurosurgeon, went outside of Trauma Room 1, and Mrs. Kennedy was sitting on a folding chair immediately outside of Trauma Room 1, and he told her what had happened. And so she came into the room where we were, and that was, what happened right there.
Tell us about how she had requested that the world not be informed of his death until last rites had been administered.
That's correct, and that's what was done, to the best of my knowledge.
When Mrs. Kennedy came in the first time to the trauma room, she had something in her hands. What was it, and who'd she give it to?
Well, she came in clutching a piece of his brain. I think people have seen the Zabruder film, perhaps will recall that as soon as the president was shot and he fell back, she began to climb out over the rear of the limousine. Some people thought she was trying to just get out of the car, but actually what she was doing was going back to retrieve a portion of the president's brain that was lying on the top of the car in the back. And she did that and came in with that piece of brain in her hand and handed it, I think, to Dr. Crenshaw, who had come to get me.
Tell us about when his foot was hanging outside of the sheet on the gurney.
When what?
At the moment when his foot was hanging outside the sheet from the gurney.
Oh, well, what
the
about
rings?
The foot?
The rings on the.
Oh, the rings? Yeah. Well, she came and stood by the president's head, just while we were still standing around his head, and she stood there. She was perfectly calm, obviously very shocked, but not crying or hysterical or anything like that. And as she stood there and looked at him, she took a ring from her finger and exchanged it for a ring from his finger, and stood there for a while, and then turned and walked slowly out of trauma room 1.
And what'd she do with the foot before she left?
Well, she stood by his bare foot. He had been taken out of his clothing by the nurses when he came into the trauma room 1, and so his bare foot, the right foot, was protruding out from underneath the sheet that was used to cover him, and she stood by his right foot for a moment and then bent over and kissed his foot and turned and walked out of the door.
Of all the stories you've told me, I think that one with the 2 rings, exchange of rings and kissing the foot, was the most.
Oh, that was heartbreaking, the whole thing was, but that particularly was a critical point of that whole heartbreaking experience.
Did you ever read any subsequent time what the symbolic nature of the exchange of rings was?
No, I think it was very spontaneous. I don't think there was any kind of, symbolism beyond the fact that it was just something that occurred to her, I would guess, and she seemed to do it very spontaneously.
And tell us about the priest who came and administered last rites.
Well, Father Huber had been called as soon as the president was brought into the emergency room. And so while we were there just after the president had been declared dead by Dr. Clark, our neurosurgeon, and he had told Malcolm Perry, who was, working on the president, he said, "Mac, you can stop now because he's gone." And so everybody stood back away from the cart, and, that was what happened at that time. And then Father Huber, very quickly after that, came in. He was the priest who had been called to see the president and then ultimately, of course, to administer last rites. And so he came, and I was still standing at the head of the cart, and Father Huber went over to the president, and I couldn't hear anything but the first words out of his mouth, and he said to the president, "If thou livest," and then I couldn't hear anything else he said.
The Father Hubert, I believe, was a priest at the Holy Trinity down on Oak Lawn, which was about 5 minutes from Parkland Hospital, and that's why he was summoned. Then what did they do with the president's body?
Well, after he was declared dead, which was, of course, very quickly after he came into the room, trauma room 1, we all left, the doctors that were there with him, and went upstairs to the operating room and sat down there outside the nurses' station. And so after we did that, the president's body was rolled out of the trauma room 1, and it was being carried out toward the ambulance that was waiting to take him back to Washington. And one of the people who were there, they were going to try to keep the president's body there for a post-mortem, but the Secret Service men stopped that, and everybody had to stand back while they rolled the president back out to the car and back out to Love Field to take him back.
The man who was to do the autopsy on the president in Dallas had done hundreds of autopsies because at Parkland Hospital, that's where they took the murder victims and the killings and so forth. So he was used to seeing a lot of violent type crimes, people who were victims of violent crime. And he was to be doing the autopsy, but what did he do? Did he ever get a chance to look at the president's body?
No. It took him over completely as they were rolling him down the hall, to the car and out to Love Field.
My understanding was he made an attempt to try to start the autopsy, and they basically took him over and put him in a chair and basically forced him to stay.
Yeah, well, he didn't even get to the point where he could, he wasn't at a point on the table where he could do it. That was all out in the hallway just outside Parkland Hospital's emergency room.
So as a result of that decision made, an experienced person who'd done hundreds of autopsies was not permitted to do the autopsy according to the state law of Texas. And the autopsy was done in Washington that night. Do you know much about what occurred there?
Not really. Only what everybody read in the reports about that. And the two men who did the autopsy, from what we understood, were really kind of administrative pathologists and had not done nearly as many reports and pathological examinations as the pathologist at Parkland.
Would you agree that the man who was assigned to do the president's autopsy at Parkland was far more experienced?
Oh, far more experienced. He'd had hundreds and hundreds of traumatic wounds that he had autopsied like that.
The president was taken back to Washington that night, and but your weekend wasn't over. First of all, tell us about your memories of Governor Connolly's care that day.
The president was in what we call Trauma Room 1. Immediately off the main central area of the trauma room at Parkland, on the ground floor of Parkland, was a hallway, and on each side of that hallway there were trauma rooms 1 and 2 on one side and 3 and 4 on the next. And the president was taken into Trauma Room 1, and Governor Connolly was across the hall in Trauma Room 2 while he was being treated.
Who was one of the doctors who treated Governor Connolly?
Dr. Jimmy Duke, or James Red Duke, who subsequently, he was a senior resident at that time, and he then subsequently ended up on the faculty at the University of Texas Medical School in Houston. He was a close friend of mine.
As I recall, my father was a friend of Governor and Mrs. Connolly, and my father instructed me never to discuss the assassination with Governor Connolly, even though I wanted to very badly. But Mrs. Connolly told me that she believes that the last words ever uttered to the president was from her. And she said, Mr. President, you can't say Dallas doesn't love you, and the shots came out.
Correct. That's my understanding also.
The Governor Connolly did tell my father once that the bullet was so close to his heart and lungs that it had been just a slightly different angle, he would have been dead as well.
That's correct. That's correct.
Now tell us about Sunday. Your day is just starting again.
Okay, 2 days after that, on that Friday, and then on Sunday, my wife and I and my young children had been to church. They had been to Sunday school, and we had just gotten back from church, Highland Park Methodist Church, there off Hillcrest, and they were upstairs changing to go out to lunch, and I thought, I'll sit down and turn the television on and see what's going on now. Well, as it happened, just as I turned the television set on and before the picture formed, I heard the words, "He's been shot, he's been shot." And I thought, my goodness, what now? And then the picture formed, and I could see what had just happened, that Ruby had just walked up and shot, him in the abdomen. And so I got up out of my chair and walked to the foot of my stair, and I said, they've called up to my wife, and I said, I'm going to have to miss lunch because I have to go to Parkland. They've just shot Oswald. She called down and said, who is Oswald? And I said, he's the man they say shot, Oswald. Yeah.
And you suddenly departed to go to Parkland Hospital.
Right.
And tell us about the surgery that ensued.
Well, I drove quickly out to Parkland and found out that he was in the operating room and went up there, and fortunately he was still breathing, and there was a probability that we at least had a chance, unlike with the president, that Oswald could have been saved. But in the process, his cardiac activity stopped, and we opened his chest, and Dr. Ron Jones and I massaged his heart for several minutes, and at first we thought it would come back, but then it was obvious that it was not going to come back, and so he was declared dead.
There was a point there at the beginning of the surgery, you indicated that there was some cause for optimism, but the blood loss had been so tremendous that hopes suddenly started to fade. And could you tell us about that?
Well, we were not doing much closed chest massage at that time. They were just starting to do that. And so when he arrested, there was a sort of a rapid attempt to do the closed chest massage, but it was apparent that that was not going to be effective. And also because of the injury, it was decided that he was dead.
Tell us, how did that weekend affect your life and transform you as a person?
Well, I can't say that it transformed me as a person. Of course, that was the most sentinel event of my life ever before, and probably ever will be, of course. And but as far as being actually different from anything that I did, it was not. I was a trauma surgeon, and that was what I did, all the time. Yeah, and even though this was the president, I went on with my career, and I can't say that it had some great change in my life after that. It certainly was a terrible thing. I'm not discounting that, but I'm just saying that it didn't really change my life in any significant way.
One last question, and we'll take audience questions. You had mentioned that Mrs. Kennedy had made several attempts to come to the operating table, and how did y'all deal with her in those precious moments? How did y'all console her at the same time, keep her away from the table?
Right. Well, she was sitting in a folding chair outside of Trauma Room 1 where the president was being treated. And as we were working on the president, she came into the room and stood across from what we were doing, and Dr. Clark, our neurosurgeon, who had come into the room, very gently ushered her back out to try to protect her from the terrible things going on there. And she went back out, but then she came back in a moment and stood there, until he was pronounced dead.
This is more of a medical question, but it's considering what's available today. Would there be anything different at the trauma room?
No, most certainly, because as I said, I was standing immediately behind his head, about 18 inches above it, and while Dr. Perry and Dr. Baxter were working on the cardiac activity, I could look down as I held a retractor in the incision they were making in his neck to put a tracheotomy tube in. I looked into that wound for several minutes, and I could see that the back half of the right side of his brain, through this large opening about 5 inches in diameter on the right side of the back of his skull, that about half of the right side of his brain had been blown out. And as I stood there, in fact, through that massive hole, the cerebellum, that is the part of the brain that's way in the back, fell out slowly onto the cart in front of me.
And can you explain to them that the medulla had not been hurt, and that's why he continued to live for a half hour after the shooting?
That's correct. All the cardiorespiratory basic activity is triggered by what's called the medulla, which is at the base of the brain, the medulla oblongata, and that had not been injured. But despite that, with a massive injury, of course, and the shock that went with that, then that did not continue to work for long. And so his spontaneous respiration and cardiac activity stopped.
I'm going to take audience questions, and y'all have just witnessed an eyewitness to history.
Yeah.
How many thousands of times have you told this story?
Oh, goodness. I can't begin, to say that. Many, many times, of course. It's been blazoned in my mind, as I think you can well imagine, and I can almost see it as vividly now as I could then.
When were you approached by someone in the FBI or CIA to keep your opinion to yourself?
Oh, that was some time after the assassination occurred and the Warren Commission, was set up. I wasn't confronted immediately with anybody like that.
Okay, thank you.
Did the state law of Texas in 1963 require that an autopsy be done in Dallas County?
That's correct. And what happened there, as soon as the president expired, he was rolled out of Trauma Room 1 and was being carried out down a long corridor just outside the emergency room toward the ambulance that was waiting outside to take him back to the airport and back to Washington. And as they were rolling that out, then one of the pathologists, who was a very expert medical legal pathologist, stepped out and told them to stop, and that he told them that any murder that's committed in the state of Texas, that a postmortem needed to be performed in the state of Texas. And with that, the two Secret Service men who were walking in front of the cart that the president was lying on, and Mrs. Kennedy was walking beside the cart, they went over to the pathologist, and one of them put his hands underneath the pathologist's armpits and lifted him up off the ground and set him over against the wall in the hallway and shook his finger in his face, and they turned and rolled the president out of the Parkland Hospital to the ambulance to take him back to Love Field.
In your opinion, from your best recollection, do you think that any of those autopsy pictures that the public saw, do you think that they could have been altered or doctored?
Well, I know many people have said that, and I've seen those pictures, but basically what I saw there, and most significantly, when I saw the Zabruder film of the assassination many years later, probably not until the mid-'70s, I happened to be coming home from Parkland after a night there, and my wife was sitting watching television on the Johnny Carson show, and she said, "Oh, come in here quick," because Geraldo Rivera had obtained films of the president's assassination, and so I went in and sat down quickly and saw for the first time the Zabruder film of the assassination. And as I think probably most everybody in this room has seen, as the president's limousine came down off of downtown Dallas onto Elm Street, headed toward the triple underpass, initially as they made that turn, he and Mrs. Kennedy, who were sitting in the limousine, looked perfectly okay. And just as they made the turn, then all of a sudden, both of the president's hands went up to his neck like this, and clearly something had happened. And then the motorcade, though, kept proceeding slowly toward the triple underpass, and Mrs. Kennedy very quickly realized something was wrong with the president holding his hands up to his neck like that, and she leaned over to him as if to ask what was wrong. This was shown in the Zabruder film. And as she did that, all of a sudden, the president's head literally exploded. And it looked like it was, to me, on the Zabruder film, from a shot fired not from behind, but from in front of the president, because he fell backward and to the left.
Could you tell from the, when you're in the trauma room, could you tell from the medical evidence that you were seeing which way the shot came from?
Well, not from the medical evidence. You know, what I saw when I got to the head of the table, I walked around just as Dr. Perry and Dr. Baxter were starting to put in the tracheostomy tube and make the incision in his neck. Dr. Perry handed me, pardon me, a surgical retractor and said, Mac, would you stand here and hold this retractor so we can see to put the tracheostomy in? Well, when I walked to the head of the table, the first thing that I saw was this huge hole on the right side of the back of the president's head that was about 5 inches in diameter. And as I stood there, in fact, I said to Dr. Perry, I said, my goodness, have you seen the back of his head? It's gone. And Dr. Perry said, no, we just walked in here ahead of you. We haven't had a chance to see that. And they assumed that he had been shot. Probably, they didn't see an entry wound, but it probably was in the hairline in the front. And so I said, well, the whole back of his head on the right side is gone. And as I stood there, in fact, his cerebellum, the most backward part of the brain, fell out of that hole onto the cart. And he shortly after that ceased all cardiac and respiratory activity.
Do you know how many pathologists were on the Warren Commission?
I don't know the exact number, but there were, I think the pathology report that came out of Parkland from our medical legal pathologist here at Parkland was very good. And it seemed to me that they should have depended more on that than the two pathologists who did the postmortem, who really were just kind of, as I understood it, administrative pathologists without nearly the experience of our pathologists at Parkland.
What, more than anything, caused Oswald's demise?
Oh, he was in deep shock. Of course, immediately when Oswald shot him, it seemed he was shot in the side. Had he been shot from the front, I think he might not have died. But as it was, when he saw, the putative assassin moving toward him, as anybody would, he tried to move out of the way and turned his left side to Oswald's gun, and the bullet, when it went off, went not through him from the front to the back, but across the back of his abdomen and injured both his vena cava and his aorta, the two major venous and arterial blood vessels in the abdomen. And he just bled out. It's a wonder that he was alive at all when he arrived at Parkland, but he was still having cardiac activity somehow or other and making agonal, that is death-like attempts to breathe when he was there in the emergency room, which soon quickly stopped after that.
Doctor, when the Warren Commission began to investigate the assassination, how much of your testimony became part of the final report?
How much of the testimony?
Of your testimony became part of their final report?
Well, I was on the testimony, but they came down. Dr. Perry went to Washington and testified directly to the Warren Commission. But those of us here in Dallas, they sent people in the Warren Commission down to interview us right after that. So that's where we came into contact with the Warren Commission.
I realize this is total speculation, but in your estimation, if the autopsy had been allowed to be performed here in Dallas, would it have been totally clear the direction of the shots and ultimately where everything came from in terms of the bullets, and we could have not had all this controversy over the year about whether it was from behind or in front?
Yeah. Well, of course, it's still just speculation on my part, but again, from having seen the assassination on the Zabruder film, and then having seen what I saw in Trauma Room 1, I'm in my own mind convinced that the bullet that hit the president came from the picket fence behind, the grassy knoll, and that the first bullet, though, hit him from the back, was fired from another direction from the back and came out his neck. We know that he had a little wound in his neck next to, but not through the windpipe. But the wound that killed him, and I saw this, as I'm sure many of you did, maybe on the film of the Zabruder film of the assassination, that when the president's motorcade came off onto Elm Street from downtown Dallas, as they were turning toward the triple underpass, the president's hands, all of a sudden, as they made that turn, went up to his throat. And you can see that on the film. And then as the motorcade proceeded on down toward the triple underpass, Mrs. Kennedy now realizes that something has happened, and she's leaning over to the president as if to ask what's wrong. And just as she did that, then I think a shot from the front, fired from the picket fence on the grassy knoll in all likelihood, hit the president probably at the hairline on the right side of his head and blew out the back of his head along with the back half of his brain and then the cerebellum. This is the shirt that I had on that day, and that blood stain had come through my trousers onto the tail of my shirt. My suit, which I was wearing, I didn't have time, of course, to change, was completely soaked in blood. But my wife, the next day, took that to the cleaners, and the cleaner recognized it for what it was, and he asked her, he said, "You want to get this cleaned?" And she said, "Well, my husband only has one other suit." And so they cleaned the suit, which was soaked in blood, but we had the presence of mind, at least, to save the shirt that I was wearing, which is here in this package. And that's the blood stain on the shirt.
Yeah, to follow up on the question down here as far as a time frame, what would you estimate was the number of minutes between when you first went into the room and when he was declared dead? And then once he was declared dead, what was the immediate reaction of the attending doctors there? Was there a stunned silence, or was there, any discussion? What was, the immediate aftermath?
Right. Well, after the president was pronounced dead very quickly, then Dr. Kemp Clark, who was our professor of neurosurgery, is still just a young man himself, had come into the room and was standing next to the cart the president was lying on. And Dr. Perry, Dr. Baxter, and all of us were working on the president. And then when the cardiac monitor straight-lined, Dr. Clark said to Dr. Perry, and these are his exact words, he said, "Dr. Perry, or Mac," he called him, "you can stop now because he's gone. The president is gone," and he had seen that straight line.
Doctor, unfortunately, I've seen the result of these kinds of injuries because of where I served in the military. So my question to you is, and I agree, the shot most likely had to come from the front. Have you been up on that knoll and looked back to see what kind of impression you get from where that shot may have come from?
Yes, the strong impression that I got was that the first shot, came from behind and from above. The first shot that hit him high in the back, and when the president raised his hands up to his neck, and then the next shot, clearly to me, came from the front because of the way his head moved backward and to the left as the motorcade was proceeding toward the picket fence.
It's just there's a doctor here in town named Malcolm Perry. He's my urologist.
Oh, yes.
And I know he had a father named Malcolm Perry.
Yes.
Is this the same Dr. Perry?
Mm-hmm.
He's a urologist, I was told.
Yes.
Your urologist is the son of the Dr. Perry he's talking about, who's the grandson of the Dr. Perry who was a doctor in Allen back in the Depression.
Right.
There's a question back here. Anybody else over here? Well, I'll come back in a minute.
Hello. First, I want to say thank you for being here. It's a pleasure to have you here again. And I'm just curious, what ultimately happened with Governor Connolly?
Oh, what happened with Governor Connolly?
Yeah.
Governor Connolly, who came in, of course, at the same time, the president was treated in what we call Trauma Room 1. The emergency room at Parkland at that time was much smaller than it is now. And what you did, you came and pulled the ambulances into the back, and all of the patients were brought into the back, and the trauma patients were brought then down through a little hallway just off of the back of the emergency room. And on one side, there were Trauma Room 1 and 2, and on the other side of that hallway, Trauma Room 3 and 4. And so the president was taken into Trauma Room 1, and Governor Connolly was taken into Trauma Room right across the hall from him. And did what? Oh, Governor Connolly did, yes. He survived very, very readily.
Okay, back here.
Sir, I have one question. There has been some writings that President Kennedy, because of his back, was wearing a very strict back brace.
Right.
Had he not had that on, the first bullet would have knocked him down, and he probably would have survived that attempt of his death.
Well, I know that's brought up. I've heard that, many times. And that's not a unreasonable thing to think, because, as I said, you can see on the Zabruder film that he was initially struck from the back and was, then sort of sitting up straight. And had he been hit from the back, had he not had that brace on, he probably would have gone forward, and they might have missed, the headshot from the front. But that's speculation, of course, altogether. But that's at least something that's been discussed and thought about.
One quick question.
Do you believe in the single bullet theory that went through Kennedy and went through into Connolly?
Well, that's a very, mixed question, and there's a lot of different opinions on that. I think Connolly himself, thought that there was another shooter, but that, was not the decision of the Warren Commission. And I think it could be either way, that he was hit, first, and you can see in the Zabruder film how he reacts to that. And then shortly or immediately after that, the president is hit in the head and falls, like he did.
One thing I meant to point out during our discussion was that one of the reasons that Dr. Perry elected to do the tracheotomy is that first bullet had miraculously avoided the carotid artery and the spinal column.
That's right. And so, that, of course, the carotid artery is the artery that supplies the brain. And Dr. Perry, of course, didn't know the extent of the brain injury at that time, which was an unsalvageable brain injury because he actually lost the back half of the right side of his brain and the cerebellum. But, you have to give the patient the benefit of the doubt. And so Dr. Perry was trying to establish a much more secure airway than an endotracheal tube provides.
According to the laws of the state of Texas, there should have been a homicide investigation, and there's no statute of limitations on that, as a matter of fact. And my question is, why was it not done, or why couldn't it still be done?
Well, that's a good question. Why did he not get his postmortem performed here? We had actually at Parkland, as I think you might imagine, excellent medical legal pathologists, some of the best in the world. And so as the president was being rolled out of the back of Parkland, they to take him into the postmortem room at Parkland, the Secret Service men stopped that little procession out of, toward the postmortem room, and so we didn't get the opportunity to keep Kennedy here at Parkland, where I think he would have gotten a better postmortem than he got in Washington that night.
One of the patrons wants to know, was there a bullet found on the gurney during the surgery?
That I don't really know. I just heard that, like everybody else
you didn't
has.
see one?
I didn't see one, no.
One last question.
Is it known after the president died who made the decision so quickly that the autopsy would not be done in Texas?
Well, I can't really, give a detailed answer to that, but there was no question that they were not going to leave him at Parkland, as I said, and so they took him away, and without, permission. There was a state law that any murder that's committed in the state of Texas, the victim must undergo a postmortem here in the state, but they didn't allow that to happen.
What's your question over there? Did you ever meet Abraham Zabruder?
Well, not really, I've known about him, but I didn't really, have any contact with him.
Dr. McClelland, thank you so much.
Thank you.